Hi everyone, thanks for listening to all my presentations. Today I'll be talking about metformin. Metformin could come under different brand names like Glucophage, Glucophage XR, Reumet or Reumet ER, Topiramate, Glumetza, Apple Metformin or Apple Metformin ER, that is extended release, Arrow Metformin or Down Metformin, and so on. Is an anti-diabetic agent, specifically biguanide. Metformin has been around for a long time and could be used in antipsychotic-induced weight gain, in type 2 diabetes mellitus prevention and treatment, or in gestational diabetes mellitus treatment. Also in polycystic ovarian syndrome oligomenorrhea treatment, or in polycystic ovarian syndrome ovarian hyperstimulation syndrome prevention. Very helpful also when it comes to the management of obesity. Metformin could appear in various forms, in form of solution per oral azidochloride, and in that case we can find Reumet 500 mg per 5 ml or generic 500 mg per 5 ml as a form of suspension reconstituted extended release. You can have Reumet extended release 500 mg per 5 ml. Could be in form of a tablet per oral azidochloride, and that could be Glucophage 500 mg or 850 mg. Could be Glucophage 1000 mg or generic as 500 mg, 850 mg or 1000 mg. Could be Glycon 500 mg or 850 mg. Could also be form of tablet extended release 24 hours. In that case, we have Fortman 500 mg or 1000 mg, Glucophage XR 500 or 750 mg, Glumetza 500 or 1000 mg, generic 500, 750 or 1000 mg, and could be in form of a kit combination with Decare DM2 extended release tablet 500 mg. Administration. We can administer metformin with meal so as to be able to reduce gastrointestinal tract upset. We have to use the cup supplied when we are using Reumet solution and suspension. Extended release tablets should be swallowed whole. Don't crush, don't cut, don't chew. We can administer once daily dose with the evening meal, and when it comes to suspension, we have to shake very well for about 10 seconds before we administer it. We should administer Fortamate or Fortamate with a full glass of water. Adverse reactions: diarrhea, nausea and vomiting, flatulence, increased infection, flushing, palpitation, diaphoresis, hypoglycemia, and lactic acidosis. Other side effects or adverse reactions could be heartburn, dyspepsia, chills, myalgia, dyspnea, flu-like symptoms, hemolytic anemia, encephalopathy, fixed duct eruption. What are the possible contraindications? Hypersensitivity to metformin or any component of its formulation. Pregnancy and breastfeeding. If that is the case, then you should involve the obstetrician or your pharmacist. And of course, renal impairment with estimated glomerular filtration rate less than 30 mL per minute, we must not use metformin. I'll tell you why that in a bit. In diabetic ketoacidosis or any form of metabolic acidosis, no metformin. When it is serum creatinine that is greater than or equal to 136 micromole per liter in men, no metformin. And also in serum creatinine greater than or equal to 124 micromole per liter in female, no metformin. Still on contraindications, in acute myocardial infarction or shock, no metformin. In anyone taking excessive alcohol, keep metformin off the table. In respiratory failure, no metformin, please. In severe congestive cardiac failure, no metformin. In severe dehydration, metformin off the table. Yes, the reason why metformin should be taken off the table in congestive cardiac failure, respiratory failure, in renal failure is because of the lactic acidosis. Lactic acidosis has led to death in many. Hypoxemia, hypotension, bradyarrhythmia, lactate greater than 5 millimoles per liter in blood will be a big problem for us. Anion gap acidosis, and there will be no ketones. And metformin plasma level greater than 5 microgram per ml can give us that. When it comes to lactic acidosis, there are certain risk factors that we need to look out for in that patient before we will place him or her on metformin. And that is elderly patient greater than 65 will have more probability of coming down with lactic acidosis than younger patients. Anyone with renal failure, anyone with congestive cardiac failure, anyone on carbonic anhydrase inhibitor at the same time, anyone taking radiological contrast, alcoholic patients, particularly alcohol excess, liver impaired situations, sepsis, dehydrated patients, hypoxemia patients, or anyone on self-restricted fluid intake or prescribed by a physician. All these situations will treat the patient to lactic acidosis. Still on warnings, vitamin B12 deficiency could occur in anyone placed on metformin for a long time. Post-gastrointestinal tract surgery, like bariatric surgery, etc. If that is the case, we have to use immediate release or solution forms. Extended release may not have full effect here. In heart failure, we don't use metformin, particularly if the patient is unstable or confined to bed. But in a stable patient with heart failure, we can try metformin, but keep an eye on him or her. Be careful in renal failure because lactic acidosis, it will likely increase as renal function effectiveness decreases. Please have renal function tests done before starting that man or woman on metformin. Stop metformin if there is fever, trauma, infection, or surgery, and use insulin under the above situations. Drug-drug interaction. Please contact your pharmacist or clinical pharmacologist. Better still, make use of the endocrinologist in your jurisdiction. Note, we have to stop metformin on the day of surgery and until the renal function has been fully restored post-surgery. Monitoring. We have to embark on frequent analysis for glucose and ketones. Fasting blood sugar or random blood sugar could be done. Hemoglobin A1C, renal function test before starting the patient, and every year. Vitamin B12 acid every 2 to 3 years. And if megaloblastic anemia, we need to get the value of folate as well. Just trying to let us know that vitamin B12 deficiency alone is not responsible for megaloblastic anemia. Folate deficiency could be as well. Examples of where we can make use of metformin will include antipsychotic-induced weight gain treatment. In that case, we can make use of immediate release at 750 milligrams up to 2 grams in 2 to 3 divided doses, or 500 milligrams twice daily, or 850 milligrams once daily. Extended release could be 1 to 2 grams once daily. We can start with extended release 500 milligrams once daily, then increase every 2 to 6 weeks to the level as high as 1 to 2 grams. The second example is diabetes mellitus type 2 prevention. Prediabetes or body mass index greater than or equal to 35 kg per meter square, or age less than 60, or gestational diabetes mellitus in the past, we can make use of immediate release 850 milligrams once daily for 1 month, then increase the dose to 850 milligrams twice daily. In diabetes mellitus type 2 treatment, we can make use of immediate release 500 milligrams once daily or twice daily, or 850 milligrams once daily. We can increase the dose every 1 to 2 weeks. Extended release could be 500 milligrams to 1 gram once daily, and we can increase that by 500 milligrams every week to the maximum of 2 grams. And polycystic ovarian syndrome. No more. That is, we no longer recommend metformin for anovulatory infertility in women with polycystic ovarian syndrome. And we can make use of this as per the treatment of oligomenorrhea in polycystic ovarian syndrome. Here, immediate release at 1.5 to 2 grams in 2 divided doses, or immediate release 500 milligrams once daily or twice daily will be welcome. We can gradually increase the dose every 1 to 2 weeks by 500 milligrams. We can then add cyclic progestin therapy for the first 6 months until regular cycles are established. And with that, I've come to the end of this presentation on metformin. The long and short of it is metformin has been around for a long time and very helpful in the face of diabetes mellitus, particularly type 2. But we cannot shy away from the fact that we run the risk of lactic acidosis if we do not know in total the health status of the individuals that should be on metformin. Please reverse, check again those characteristics that could teach an individual to lactic acidosis while on metformin. Thanks for listening. Remember to share. Remember to subscribe. You can give thumbs up. You can leave your comment. I appreciate it.